So an ankle sprain is an injury to the ligaments that stabilize the ankle. The most common sprain is what we call an inversion sprain, where the foot goes inward and the ligaments on the outside of the ankle get injured, either torn or stretched and sprained. They're actually very common. It's one of the most common musculoskeletal injuries that we see, and certainly as a foot and ankle physician, it's among the most common injuries that we'll see both on the field and in the clinic. So athletes that are involved in a lot of running or sudden changes in direction, what we call cutting, where they plant their foot and try to go in another direction. Certainly active individuals who are out running, especially on uneven terrain, off-road and such, are at risk. Patients that have a different shape to their heel, like their heel goes a little bit inward, they're at risk, and certainly patients who have injured their ankles in the past are at higher risk of ankle sprains. So some patients will describe feeling or hearing a pop when the injury occurs. Most patients will get pain and swelling with some bruising or discoloration. Some patients will have difficulty walking immediately after the injury. They're classified in general grade 1, 2, and 3, with grade 1 being a mild sprain, grade 2 being a moderate sprain, and grade 3 being a more severe sprain. The severe sprain, grade 3, are typically complete disruption of the ligaments, and they're associated with a lot of swelling and bruising and take a lot longer to recover. So all of them are treated with initial immobilization, either in a boot or a cast or a brace, and then we use rest ice, compression, elevation, and often anti-inflammatory medications. Our goal is to reduce the swelling and the discomfort, and then we let patients get back to activities depending on their symptoms. Obviously, we can treat a low-grade sprain more aggressively than a high-grade sprain because it's a less severe injury. So we typically don't need to operate on ankle sprains acutely. In a small handful of patients who develop instability over time, meaning repeated ankle sprains, we do reconstruct the ligaments surgically. But in the acute setting, we typically don't need to do surgery. So ankle sprains are a relatively common injury. Fortunately, most of them do not require surgery, and most patients, whether they have surgery or not, are going to be able to return to their previous level of function.